the concept of actually training the physician to understand how to navigate the wider benefits array and clinical programs, et cetera, is absolutely unique. So we're joined by the CEO of Amaze, David Silverstein, and really just excited to hear a little bit about your story, David. If you could give us kind of an overview of your background and the company, and a little bit of why you built Amaze and how you came upon this strategy.
So what I'm going to talk about today is the maze that is our healthcare system and why I think the solution is to give every American a trusted and independent medical partner. I came to realize that there were a lot of things that really could be done differently. And the problem was nobody had created a business model with the right economic incentives to do what many of us know needs to be done. And that's the basis of Amaze. Amaze really began with the mission of helping people build the life skills they need to manage their own healthcare. That was the first incarnation of Amaze. The best time to develop skills, life skills, is as a child. The problem is none of us grew up being given the life skills that we need to manage our own healthcare, right? How does the system actually work? Until you have a deep understanding of how something works, you can't become an effective consumer. And when I say consumer, everybody's mind immediately goes to price. Well, we also have to understand quality, performance. In the interim, my solution was to give everybody a partner, because we're not going to simply wave a magic wand and impart the life skills that people need. The World Health Organization defines those life skills as being decision-making and problem-solving skills, critical thinking skills, communication and interpersonal skills, right? How do you talk to a doctor? Self-awareness and empathy, and coping with emotions and stress. These are what the World Health Organization tells us people need to be successful human beings and members of society. And these are the skills people need to manage their own healthcare. What this partnership we're creating is designed to do is not blow up our healthcare system. It's designed to simply flip our healthcare system upside down. I think of our healthcare system as an upside down triangle, right? We all talk about payers, providers, patients, but really what you hear all the time is payer, provider. Patient is almost an afterthought. So that's why I think of it as a system that is upside down. All I'm looking to do is flip the system right side up, right? I'm not trying to blow up the whole system. I think that's not going to happen in our lifetimes. But can we flip the pyramid and put the patient back on top, put the patient in charge where they belong? I think we can. So what Amaze does, what the partnership means, is taking the disjointed model we have today, that's typically referred to as a set of point solutions. The National Business Group on Health put out a report in 2018 that tells us the average large company in the United States provides their people with 14 independent healthcare solutions. There might be 2 or 3 choices of health plan, right? There's a wellness program, there's a telemedicine service, there's a mental health service, there's a second opinion service, and they're disjointed. Every solution seems like a good idea when you look at it independently, but when you put it together as a system, we know the solution fails. It fails to deliver on the promises of driving down costs, providing better care. Most employees can't name 2 of the services their companies offer. Most HR managers can't name them all. Every year, a few of them change. Some of them are aligned with the carrier. So if you change insurance plans, then your other services change with it. And so for many, many reasons, all of these disjointed point solutions aren't delivering on their promises, even though they seem like good ideas. The result is we think of them as commodities. We think of them as a check in the box. We know there's many services that people just never use. So what Amaze has said is everybody needs a single trusted partner. We should be getting all of these services from the same partner. Now, when I say get these services from the same partner, I don't mean taking a mobile device or a website and saying, here's a button for each of these services. And when you click, I want to talk to a doctor, you get connected to Teladoc. And when you say, I need a second opinion, you get connected to this second opinion service. I'm talking about a single trusted partner who actually provides all of these services to you and helps you navigate them. I'm not talking about a call center operator who says, oh, sir, you're looking for a second opinion. Let me have somebody from that company call you. No, I'm talking about actually doing all of these things through one very simple, easy to manage service. And let me explain to you what it really means to put all of these things together in a single partnership. We refer to it at Amaze as having one partner, one platform, and one name to trust. In other words, when you need something, you call Amaze. If you're not sure who to call, you call Amaze and you ask, because the answer is going to be call Amaze. In other words, you will always have called the right place, but we're not coordinators. When you call Amaze, you're calling because you have a subscription. That means you never think twice. You never hesitate. Never cost anybody anything. The subscription's already paid. When you call us, it's one touch of a button. No intake form, no questions to ask, no triage process. You will never touch a letter on a keypad before initiating a call with Amaze. You call us for everything. So it's this single integrated solution, and we put medical providers up front. When I say medical provider, I mean a physician, a nurse practitioner, or a PA, somebody who can diagnose, treat, prescribe, order, refer. That's who actually takes your call. See, most of medicine today is very transactional in nature. You call a telemedicine service, they are sending your call to the next available medical provider who's going to diagnose and, if possible, treat. Because it's transactional, there's no relationship, there's no follow-up, there's no desire to push the boundaries a little bit. So you start to see everything changes, and then we use a tremendous amount of technology to enhance all of that. What we call smart triggers, patented technology, things like a geofence around every emergency room parking lot. You pull into an emergency room parking lot and you get, maybe you were given Amaze by your employer 15 months ago, and you're young, you're healthy, you didn't need it, you haven't needed any help in the last 15 months, you completely forgot. This is one of the reasons that the point solutions don't get used, is people either never know about them in the first place, or they forget about them, or they didn't set up. And so when you put it all together, the utilization of these services goes through the roof. The trust that evolves, because everybody has a trusted independent medical partner, takes things one step further. People let us know about things going on in their life when they don't even know they're looking for help. It only happens because of the one partner, one platform, one name to trust concept, that independent, trusted partner that led the woman to let us know what's going on. So in addition to driving down costs, you know, the feedback companies are getting from their employees on almost a daily basis has just been phenomenal. At Amaze, we are changing the way medical care is actually delivered. We think we're the first company really optimizing the virtual environment to do the things that can be done better because we're in a virtual environment today.